continuous cardiac education series from UNMICRC Institute of Cardiology and Research Center, Ahmedabad. And today's my topic of presentation is history of cardiac surgery. Each state and country has its own history. Like that, cardiac surgery has also its history, which is very interesting and important to learn. So first we have to know the importance of the history. Until and unless you don't know the history to which you are belonging, you cannot give justice to your work. So you have to know the past to understand the present. And Martin Luther King has said, we are not makers of history, we are made by history. So this is the importance of the history. Now we look into the history of the cardiac surgery. Dr. Theodore Billroth, who is believed to be the father of modern abdominal surgery, has attributed with the statement that any surgeon who would attempt an operation on the heart will fail and should lose the respect of his colleagues. So in past times, in the around 1890, the surgeons were not doing the cardiac surgery, and they were afraid to open the chest and open on the heart surgery. So this statement is regarding it, Dr. Billroth's statement. And Paget in his book of surgery has also published that surgery of the heart has probably reached the limits set by nature to all surgery. No new method and no new discovery can overcome the natural difficulties that attend a wound of the heart. This is the statement made by Dr. Paget in 1896. Now in the same year, Dr. Ludwig Renn from Frankfurt has changed this belief. There was a patient named Wilhelm Justus who was 22-year old working as gardener. He got stab wound in his chest and came to the municipal hospital for admission. And then at that time Dr. Ludwig Renn was the professor of the surgery and head of department. He was out of the town for 2 days, and he was taken care by Dr. Siegel, who was working under Dr. Ludwig Renn. His condition was stable at the time of the admission, and but with as the time passing, his condition was little bit become deteriorating. His pulse became diminished, his breathing was becoming labored, and his neck veins become engorged. Dr. Siegel has informed the condition to Dr. Ludwig Renn regarding this. When Dr. Ludwig Renn came to the town, he decided to operate upon him. He operated upon him. He opened the chest, opened the pericardial cavity, found blood clots inside it, and then he finally removed clots, and he found a 1.5 centimeter tear on the heart, and he repaired it with 3 black silk stitches. Now he has changed the belief of Dr. Billroth that he was given in the past. Everyone knows that something cannot be done until someone comes along who doesn't know that it is impossible and he does it. So Dr. Ludwig Renn has done it. He has changed the belief, and he successfully operated on the stab wound of the heart, and the patient survived. In 1908, Dr. Ludwig Renn has published the case of series of 124 patients on who he has operated, and 40% survival rate he has. Now I will tell about some discoveries which are important in the history of the cardiac surgery. One of which is the history of the heparin. J. Maclean, who was the medical student of the second year, he has discovered the heparin. The history of heparin is very much important, because in every cardiopulmonary bypass cases we give heparin at the initiation. So contribution of J. Maclean is very important. He has worked with William Henry Dowell. The contribution of the Dr. Alexis Carrel is also important, because the technique for suturing of the blood vessels was not available at that time. Dr. Alexis Carrel has invented the technique for anastomosis on the blood vessels and the heart. Dr. Alexis Carrel, when he was studying, At that time, the French president Sani Carbot has got stab injury over the abdomen and got laceration of the hepatic veins. The surgeons at that time do not have any technique for repair of the blood vessels, and the president has died at that time. So Dr. Alexis Carrel has decided to find a technique to suture the blood vessels, and he has worked for many years, and he has found technique for the anastomosis of the blood vessels, and then he has worked on it, and he has found the techniques. The history of the blood transfusion. The blood groups were invented by Dr. Karl Landsteiner as blood group A, B, AB and O, which are very important because without blood cardiac surgery will not have been possible. So the history of the blood transfusion is also important. The history of the cardiac catheterization. For the diagnosis of the heart disease, the cardiac catheterization was also one of the important history. Werner Forsman in 1929, he has published a paper in which he has said that procedure would permit measurement of the pressures in various heart chambers, and by means of the injection of radiopaque substances would make it possible to see the internal morphology of the heart. Werner Forsman was in search of the technique that would allow injection of the drugs directly into the heart cavities. So he has made a self experiment. He has made a nurse stood in front of him. He injected small thin catheter into his own vein and guided it up till it reaches the heart chambers. Then he go into the basement, took X-ray and found the position of the catheter tip inside the heart chambers. So he did a self experiment on it, and he found that with the help of this technique, the pressure within the different heart chambers can be measured, and the drugs and radiopaque dyes can be inserted to see the morphology and anatomy of the heart. But his self experiment was criticized, and he has to left for the further research on this work. His efforts were unrecognized until Dr. Andre Carnot, who after the 26 years of this incident got a Nobel Prize, but he refused to take the Nobel Prize and said that he would accept only if it was given to Dr. Werner Forsman. So Dr. Werner Forsman has left the job and was working as the urologist. And he has also worked in the Second World War in the Army Journal. So after 26 years, the people found Dr. Werner Forsman's contribution, and Dr. Andre Carnot has taken the same technique which was given by Werner Forsman in publication. Now the history of the cardiac surgery. This is the structure which is PDA, patent ductus arteriosus, which is the communication between the aorta and the pulmonary artery. The people would afraid to open the chest and operate upon this condition, but the Dr. Robert Gross, who was at Boston Children's Hospital, ligated the patent ductus arteriosus in 1938. The patient was Lawrence Finney, a 7 years old girl who was weak and tired easily. His parents was complaining of the constant buzzing from the chest. He came to Dr. Robert Gross. Dr. Robert Gross was 33 years chief resident at that time, and he was working under Dr. William Ladd. So Dr. William Ladd was out of the town at that time, and he know that Dr. William Ladd would not allow to operate on him. So when he was on summer vacation, Dr. Robert Gross posted this patient for surgery and operated upon him. Cyclopropane, he gave anesthesia of cyclopropane by mask, and Betty Lang was nurse anesthetist. He operated through third intercostal space and found a 7 to 8 mm diameter, 5 to 6 mm length PDA. Upon ligation, the blood pressure dropped from 110 by 35 to 125 by 90, and the surgery was successful. So this was the history of the PDA ligation. Now the second case come with the patient of the tetralogy of the fellow. 15-month-old baby Ellen Saxon, who was diagnosed as tetralogy of fellow, was diagnosed by Dr. Helen Taussig. And Dr. Helen Taussig went to Dr. Robert Gross for the idea through which the more blood flow can be given to the pulmonary arteries. But Dr. Robert Gross said that I ligate the PDAs, I don't create PDAs. So Dr. Helen Taussig went to Dr. Alfred Blalock, who was working at the Johns Hopkins Hospital. They both consulted. Dr. Vivian Thomas was the technician who was assisting the Dr. Alfred Blalock, and he was hired by Blalock while the Dr. Blalock was working at Vanderbilt, and he has very good technically gifted and creative mind for the surgery. At that time, the fluoroscopy was used for the diagnosis of the congenital heart disease. You can see the classical boot-shaped heart. So Dr. Alfred Blalock and Vivian Thomas have made the idea of operating on the patient. They decided to anastomosis the pulmonary artery with the subclavian artery to deliver more blood to the pulmonary arteries. This is the operation in which we can see that Dr. Alfred Blalock is operating, and Vivian Thomas is standing behind him, giving guidance to Dr. Alfred Blalock. The operation took successfully. The blue baby Ellen Saxon become pink immediately after operation. And this is Ellen Saxon, who was after surgery. A movie was made to see the contribution of Alfred Blalock and Vivian Thomas, Something the Lord Made, in 2004, which is available, and we can see the contribution of their in the cardiac history. This is Dr. Alfred Blalock and Dr. Helen Taussig. Dr. Blalock appointed as Hopkins surgery chief after surgery. And now these all were the palliative procedures. These are not the definitive procedures to correct inside the pathology of the heart. To correct the pathology of the heart inside, Dr. John Gibbon has developed the cardiopulmonary bypass machine, and he has operated upon the 6 patients. But unfortunately, out of the 6 patients, only 1 lived and 5 has died. So he was disappointed and did not operate further. It was Dr. Gibbon with his oxygenator. Further modification was made by Dr. Kirkland in the cardiopulmonary bypass machine, and it is known as Mayo-Gibbon machine. This is the Mayo-Gibbon machine, modification by Dr. Kirkland. This we can see the blood from the patient receiving reservoir through which venous pump blood goes to the lap of the lung, and arterial pump and blood filter, and from there to the purified blood returns to the patient. Now the Dr. Clarence Walton Lillehei, who is believed to be the father of the open heart surgery, he understood that to bypass the heart, one needs a basic understanding of physiology of the circulation, a method of preventing the blood from clotting, a pump to pump the blood, and finally a method to ventilate the blood. This is Dr. Clarence Walton Lillehei. he found the controlled cross circulation technique in which the patient's parents were used as the oxygenator. The patient's blood was drained from bilateral cava into the donor, who were patient's parents, and then after reaching through lungs, the blood was returned back to the patient into the carotid artery. This is the photograph of the controlled cross circulation by Dr. Clarence Walton Lillehei. In nearby we can see the donor who is unattended, and all are paying attention to the patient being operated. Here the person who is standing behind Dr. Clarence Walton Lillehei is Dr. Norman Sungay, who later became the pioneer in the heart transplantation. Dr. Lillehei is believed to be trained more than 150 surgeons in his career, and who is the pioneer of the open heart surgery. Dr. Denton Cooley and Dr. Michael DeBakey. In 1953, they invented the technique to repair the aortic arch aneurysm repair. They both were working together until 1960. Now Richard Duvall, who was also working with the Dr. Clarence Walton Lillehei, he has found bubble oxygenator, and with the invention of the bubble oxygenator, the history of cardiac surgery has changed. This is the model for bubble oxygenator, in which the venous blood and the oxygen inlet was there, and after oxygenation there is a deforming chamber and heat exchanger in it, and finally the arterial blood outlet through which the oxygenated blood comes out. The problem with the control course circulation in the postoperative period is some patients have developed the heart block. So the William Charnock has invented the pacemaker and implanted the first pacemaker in 1958. Now with the invention of the oxygenator and cardiopulmonary bypass machine, the surgeries on the heart valve has also become possible. The first mitral valve repair in the form of the commissurotomy was done by Alien Cutler in 1923, but the patient has developed mitral regurgitation following 4 years, and he did not continue further practice. Dr. Dwight Harkin has performed the first aortic valve replacement surgery in 1960. Dr. Harkin has also worked in the World War II and involved in 139 operations for removal of the bullets and shrapnel from within and around the heart and great vessels with no surgical deaths. First mitral valve replacement was done by Dr. Albert Starr Edwards valve. Dr. Robert Gauge has performed the first coronary artery bypass grafting in 1960, but the Dr. Gauge did not recognize so much importance as that of the Dr. Clarence Walton Lillehei and Dr. Kirkland. Dr. Gauge had said that you wonder why I did not pursue the subject. The reasons are several. Our medical colleagues were violently against the procedure, and we literally had to snatch the patient from the medical department, and definitely against a procedure they considered not only to be experimental but also unwarranted. The chairman of my own department thought that I had too much work, and he suggested to concentrate on vascular surgery, and so later he concentrated on vascular surgery, and it was the only first and only coronary bypass by Dr. Gauge. William Pierce was the first to identify the ventricular assist device in the 1960s. Pierce established an interdisciplinary group to develop mechanical circulator supported device and the artificial heart. The original pneumatic heart assist pump, known as the thoracic ventricular assist device, has been used in nearly 4,000 patients for right, left, and biventricular support. And his pioneering work led him to be considered around the world as the father of the ventricular assist device. David Sebastian, he has performed the off-pump coronary artery bypass grafting in 1962. In 1960, the aortic wall and mitral wall replacement was done with the mechanical heart valves, Star Edward valves, as we have discussed. Now, the Dr. Alan Carpentier in 1965 has done bioprosthetic aortic wall replacement. This is the first successful xenograft replacement of the aortic wall in a human, which was performed by Dr. Alan Carpentier in September 1965 and his team in Paris. By January 1968, Carpentier's group had implanted 61 porcine valves in 53 patients with a high failure rate. Only 60% of the valves were functioning well at 6 months and only 45% at 1 year. So the failure rates was much higher, and the studies were initiated to investigate the immune response to the valve and determine how to decrease this response. Dr. René Favlaro, who has used the technique of the saphenous vein in the coronary artery bypass grafting, which we are using today. So this was his contribution. Now the first heart transplant was done by Dr. Christian Barnard in 1967 at Groote Hospital in Cape Town in South Africa. He did the transplant on 3 December 1967. He has a 53-year-old male patient, Mr. Vaskansky, who has end-stage heart disease, and he was waiting for the suitable heart donor to perform the heart transplant. He found that a 25-year-old woman, Dennis Darwal, has got a car accident, and he has declared as a brain dead by the neurosurgeon and physician of the hospital. So he found that this can be the opportunity, and he decided to do a heart transplant of that patient. The surgery took for 5 hours. He initiated surgery at 6:15 a.m. and he got the heart from the donor, Dennis Darwal, and transplanted it into Vaskansky. He has slight difficulty in weaning from the cardiopulmonary bypass. During the first attempt, when he was weaning, the patient has fibrillation, and he got a defibrillation, but the contraction was not good enough. During second time also, during weaning, the blood pressure was not maintaining. So he decided to further keep the patient on bypass for some time, and at third attempt he would able to wean the patient from the CPB. Mr. Vaskansky has died 18 days following the heart transplantation due to the pneumonia. The surgery was performed in the South Africa, Cape Town. At that time, the image of South Africa was poor on the world. Immediately following the surgery, Dr. Christian Barnard has called one of his friends, who was his medical colleague, and within half an hour, his colleague has called the Prime Minister of the South Africa, and they knew the importance of this surgery and put the South Africa on the map of the world. Werner Forsman, he has done percutaneous PDA device closure in 1967. Dr. Hugh Bental is known for the Bental procedure for the aneurysm of the ascending aorta. In this procedure, we are doing replacement of the aortic wall along with the ascending aorta. Dr. Robert Bartlett has used ECMO in 1976 in a patient suffering from meconium aspiration syndrome, and the patient has survived successfully. In 1976, percutaneous ASD device closure was done by Terry King and Noel Wills. In 1975, Randall Grip has developed the technique for hypothermic circulatory arrest. Sir Magdi Jacob in 1979 has found the technique of aortic root remodeling. It was used in, it is a wall preserving technique in which the ascending aorta is replaced with the Dacron graft, preserving the aortic wall. These are the photos of the Dr. Denton Cooley and Dr. Michael DeBakey. They both have worked till 1960 in the hospital, and in 1960 the Dr. Denton Cooley has left the DeBaker's Methodist Center and worked at St. Luke's Hospital, where he later developed a Texas Heart Institute. And in 1969 their rivalry become more intense when the Dr. Denton Cooley has used the device that was invented by the Dr. DeBakey without his authorization, and Dr. Michael DeBakey has said this. In 1998, Dr. Ellen Carpenter has done the first robotic mitral repair. Dr. Ellen Carpenter is known as the father of the mitral valve repair surgeries. Dr. Ellen Crebier transcatheter aortic valve replacement in 2002. Now the surgery of cardiac surgery has shifted to the robotic surgery. So this was brief information regarding cardiac history. Thank you.